Hi, this is Andrea Kane, and I'm here with you for HSC 114 Medical Terminology, where we are studying the Language of Medicine, 12th edition by Davy Ellen Shabner. We are now on week 2 in our syllabus. We are still focusing on unit objectives 9.1.1 through 9.1.13. This week you'll have 2 videos. This is the first of 2, and this is on chapter 3, suffixes. If you want to follow along, grab your textbook and turn to page 72, and we will talk about suffixes. Those are the ends of medical terms. When you think about the medical terms that we've been talking about in week 1, where you have a root and a combining vowel to equal the combining form, suffixes come after that combining vowel. And prefixes, which will be in chapter 4, that will be in the video that follows this, are what go at the beginning of the word. So you have prefixes at the beginning, suffixes at the end. Medical terms need a suffix most of the time. Sometimes they can be made up of prefixes and the combining form, but most often they need a suffix. They can get by sometimes without a prefix, but they need that suffix. So our chapter goals are to learn about some new suffixes, look at those with the combining forms to keep building and understanding terms. We're going to look at the functions of different types of blood cells in the body, kind of give us a jump toward when we get to the chapter 13, which is the blood system on week 10. So let's go ahead and dive in. Here's our first set of combining forms. Again, we're watching for vowels that are not O's, because O's are the most common. We're also looking at strange letter combinations, and we're looking for forms or things that mean the same thing that we want to make sure that we keep in our mind and we're aware of. So let's get started. Abdomino, acro, acuo, adeno, adipo or adipo, amnio, angio, arterio, arthro, axillo, bio, blepharo, broncho, carcino, cardio, chemo, chondro, chrono, colo, cysto. Encephalo, erythro, hemo, hepato, hydro, inguino, ischo, laparo, laryngo, leuco. And I'm going to stop here for a moment. I want to bring your attention to laryngo or the larynx. Notice how the meaning, larynx, there's an X on the end. But when you go to the combining form, there's no X, there's a G. If you look at the bottom of page 73 in your book, you'll notice that it talks about how anything that ends, a body part that ends in an X gets switched to a G when you're talking combining forms. So just want to bring that to your attention so that you look at that. All right, so we talked about leuco. We'll keep going. Lympho, mammo, masto. Okay, here I want to stop. Notice there are 2 combining forms for breast, and they are different, mammo and masto. And so you'll have to learn the context of what is masto versus what is mammo. So think of a mammogram versus a mastectomy. That would be an example that of two different ways. They both mean breast, but they also have 2 different spellings. Morpho, muco, myo, myelo. Watch out for myo and myelo, 2 very different things. Necro, nephro, neuro. Neutro, nucleo, ophthalmo. Oh, let's pause on ophthalmo. Make sure you learn the OPH, TH, those 4 letters together. They don't look like they belong together, but when it comes to this particular medical term, they do. So make sure you get those H's where they belong, as well as that P in there. Osteo, oto, patho, peritoneo, phago, phlebo, plazo. Pleuro, pneumono, pulmono. All right, we've got two for lungs there, but they're very different. Pneumonia versus pulmonary. So you'll want to keep those in mind. Radio, recto, reno, rhino, sarco, spleno, staphylo. Strepto, thoraco, thrombo, tonsillo, tracheo, veno or veno. So those are some combining forms, and now we're going to move on to a few suffixes to be familiar with. Alga, seal, centesis, coccus, staphylococcus. That's an example, and we'll talk about the different, whether you're talking staph or strep, those different types of coccus or cocci for the plural. But make sure that you know that that is a suffix, and it means a berry-shaped bacterium. So it gives you this shape based on the suffix. Site, Dina, ectomy, emia, genesis, gram. Graph, graphy, itis, logi or logi, lysis, malacia, megalyoma, opsiosis. Pathy, penia, phobia, plasia, plasty. Ptosis, you drop the P for the most part, ptosis. Blepharoptosis is an example of where you're using ptosis as a suffix. Blepharo refers to the eyelid. So if you have blepharoptosis, you have a drooping eyelid. Rhea. Okay, watch out for that RRH combination. You're going to run across it many times. So make sure that you, whenever you hear of Rhea, and anything, you're going to see some more with RRH. So you're going to want to make sure that that's just in your mind of how that is. Sclerosis, scope, scopy, stasis. Stomy. Stomy is different than tomy. Look down too. You've got stomy. That's an opening. Tomy or otomy, like if you're talking about someone putting in doing a laparotomy. A laparotomy is an incision into the abdomen. Laparotomy. Abdominal pelvic area, I would give you for otomy or for laparotomy. Stomy is like an ostomy. That's where you've done a type of opening. Colostomy would be another example of that. So make sure that S changes the meaning significantly from stomy to tomy or otomy, however you want to do that. Then there's therapy and trophy. Which term means fear of heights? Fear of heights. Well, notice 3 of these have the suffix phobia. That means fear. So automatically you can strike the first one out because the suffix doesn't mean fear. Now you've got to go back and look at hydro, acro, and agora and figure out what those meanings are. I'll give you one more hint. Hydro is water. So it's fear of water. So you can strike A and B. Now you've got to figure out the difference between C and D. I leave you to it. All right, suffixes and terminology. Now we have some more suffixes, and some of these, as you'll notice, with ol and ul, they're a 1-letter difference and they both mean the same thing. So you're going to run into that where you're going to have to be careful, and same with and eum. So you have ia, ist, ol, ul, eum, us, and y, or e, however it's going to be pronounced in this situation. AC and EAC. And now this screen is one that is very frustrating, I think, because look at all of those. They all mean pertaining to, every last one of them. And I think, yes, here, there's some more that mean pertaining to on these two slides. Oh, joy. So you have all of these different spellings, and they all have the same meaning. And there's just no way around it. You're going to have to memorize them. I'm sorry. It just is. The other thing is you can kind of mentally memorize everything else, and if it doesn't fall into everything else, a good guess will be pertaining to. So you have AC and EAC, AL, R, EEL, GENIC, IC, ICL, OS, US, and TIC. Those are all your pertaining tos. And then you have OID, which means resembling. So like I said, it might be easier to memorize OID and then presume everything else is going to mean pertaining to. So let's talk about how we can build some terms using our combining form and our suffix. So we have arthritis. Itis means inflammation, and arthur is joint. So inflammation of the joint, because remember we read back to front. Blepharoptosis, I talked about this one earlier. Blepharoptosis, this is a drooping eyelid. Ptosis is that drooping, blepharo is the eyelid. Ischemia, emia is a loss of normal. Something is not normal. It's abnormal. Ish means blood flow. So this is abnormal blood flow. It's not happening. It's a loss of it. Osteogenic means produced by bone tissue. The genic is where you get the produced by or generated by. And then the osteo is bone. So it's produced or generated by the bone or the tissue in the bone. Now we talked about staph and strep as types of coccus. Here you get staphylococci or coccus. And you've got the berry-shaped bacteria, but staph means it grows in clusters. Because remember, Staphylococcus is the berry-shaped bacteria. The staphylo is the clusters. I think if we go back a few slides, back here. Yes, staph is clusters. Now let's take a look at strep. That's twisted chains. So if you have streptococcus, you have twisted chains of that berry-shaped bacteria. So that is the difference. All right, so chains versus clusters. Now we're going to talk about actual conditions. And if you are in your book, I have flown through. I tend to do that, I'm afraid. I get excited and I keep going. We're now up to page 82. So if you've been following along in your book, we're now at page 82. And we're going to talk about hernias. This is where you have a protrusion of an organ or the muscular wall of an organ through the cavity that normally contains it. So normally there's a cavity and it keeps the organ or the muscle wall of that organ inside that cavity. Sometimes that organ or that muscle part of the organ pushes through that cavity, and that's what's called a hernia. They give you pictures here, and these are female side views, lateral views, where you can see on one side a cystocele, where the bladder, the urinary bladder, here I'll move my mouse and maybe that'll help. You can see the bladder right here. It has pushed through a wall that should be keeping it in, because compare this picture to this picture. In this picture, the bladder is protruding through. In this picture, it's nowhere near. It's behaving itself. It's staying within the boundaries it's meant to be. So this is what's called a cystocele. It's a hernia that involves the bladder. Okay? Now on this side, you've got the rectum. And the rectum this time is pushing outside of its boundaries. It's not staying contained where it's supposed to. So if you come over here, this is how it's normally supposed to look. And over here, you've got that protrusion, that pushing out. So you have a hernia of the rectum, a rectocele. All right? And in your book, it also shows you an omphalocele, and that is, it has to do with some muscles in the abdominal area. And so it'll go through that. Moving on. Oh, we just did this. We just did this. What is a rectocele? This should be a really easy one to answer because we just talked about it. All right, so let's move on to those bacteria, whether they grow in chains or whether they grow in clusters. So if you have the chains, remember you have strep. Strep is chain. Cluster is staph. So strep and staph. Now let's look at blood cells. And this, oh, really quick, page 83 goes into detail about staph and strep. And so you can learn more about it, and you can learn about MRSA, which is methicillin-resistant staph. And then you can see about some of the other ways that they describe other types of bacteria. You have Diplococcus, if they're in pairs like this is Diplococcus, or cocci, sorry. And then there's pneumococci, where you have that kind of bacteria in the lungs. There's gonococci, and that's a type of bacteria that invades the reproductive organs, causing gonorrhea. Then you have other types of bacteria that are not round shapes but rods. An example they give you is C. difficile, or C. diff, which is Clostridium difficile bacteria, and then they talk about that. So well worth reading page 83 in your textbook. All right, now on to page 84, where we're going to talk about blood cells. We'll talk about erythrocytes. Those are red blood cells. So let's break it down here. Cyte is cell. Erythro means red, and the implication is red blood cell. Here, leukocytes, leuko is white cells. So you have red blood cells, white blood cells, and you can tell it right from their name. Then you have thrombocytes. All right, you're going to break it here. You know, cyte is cell. Thrombo means clot. So these are clotting cells or platelets. When we talk about erythrocytes, they are red blood cells. They're made in bone marrow. They carry oxygen from the lungs to all body cells, and they contain a blood protein called hemoglobin. And as you go through your anatomy and physiology classes, you'll learn more about that. Sometimes you'll hear people having low hemoglobin and needing iron or being anemic. So you'll hear those kinds of contexts about it. And I think when we get to the blood system, we talk more about that, if I remember correctly. So I'm not going to go into a whole lot of detail here. Leukocytes, these are white blood cells. There are 5 different kinds. They fall into 2 different categories. And you can see pictures of these in your book on page 85, and I think there might be a slide on that, but I'm not quite ready to move on yet. Granulocytes, these are formed in the bone marrow. They are either eosinophils, basophils, or neutrophils. Mononuclear leukocytes are also produced in bone marrow, but also in lymph nodes and the spleen. So mononuclear leukocytes are not just bone marrow, but also lymph nodes and spleen. There are 2 kinds of those called lymphocytes and monocytes. And I don't know if I want to go into too much detail with them. I'm trying to remember again what's going to be covered coming up. I think you just really need to be aware of these basics. Let's put it there. And we just talked about these, and we talked about these. And this is a picture of the division of leukocytes. So remember, red blood cells, there's just one type of those. They're made in the bone marrow. They carry oxygen from the lungs all the way to every single cell in the body. White blood cells are made in the bone marrow if they're granulocytes. If they're mononuclears, they may be made in the bone marrow or the lymph system or the spleen. Okay? Thrombocytes are platelets, and these are formed also in bone marrow, and they are necessary for blood clotting. Can you think about what would happen if a person's blood did not clot and they had a cut? They could bleed out. Now let's talk about the opposite. What happens if you have too much blood clotting? Your blood can't move around. It can't get oxygen to all the places it needs to get oxygen to, and that's just as bad as well, right? To have clots in your blood instead of just plain blood. So thrombocytes are one of those that have to be the right, they have to be at the right level. You can't have too many and you can't have too few. There's a range in there that they need to stay between. So yes, here's the picture that is in your book on page 85, and it gives you sort of a view of what they look like underneath the microscope. Quick quiz. Which type of blood cells are necessary for clotting? We just covered this. I know you can get it. So moving on, acromegaly. We had this term on a quiz a few slides ago, acromegaly. This is actually an endocrine disorder that occurs when the pituitary gland produces way too much growth hormone after someone has completed puberty. They just keep growing and growing and growing. It often results from a benign tumor of the pituitary gland. The person is typically of a normal height, but their bones and soft tissue in their hands, feet, and face grow abnormally beyond what is typically considered a normal range. And again, you've got to understand a normal is sort of average. And so this is considered beyond average. Many people believe Abraham Lincoln had acromegaly. And this is at the top of page 86. And it gives you an example of the author's grandmother who was believed to have had acromegaly. Shows pictures in her of her aging over time. Now we go into laparoscopy. This is a type of minimally invasive surgery where you go in through tiny incisions or ports in the abdomen. You use a laparoscope, which is lighted, and you take a look around. Basically, that's what you do. You go in, you take a look around. There are laparoscopic surgeries, meaning that you go in and you do surgery after you look around using the laparoscope to help you visualize what you're doing. So just so you know. And that's at the bottom of page 86. Adenoids. Did you know we all have adenoids? And that is on page 87. These are small masses of lymphatic tissue that are located in the part of our pharynx or our throat near our nose nasal passages. The literal meaning for adenoids is resembling glands. Can you see that? You got the oid for resembling, and adeno is gland. So it's resembling glands. And they're not endocrine or exocrine glands. They're just there. They do capture some bacteria, and for those who might have had tonsillitis multiple times as a child and then had their tonsils and adenoids removed, they can get enlarged, block the airway, and a lot of times when physicians like ENT surgeons, ear, nose, throat, when they do a tonsillectomy, they go ahead and take the adenoids as well so that they don't become infected afterwards and cause problems. So there is that as well. And that is it for chapter 3. I will be back shortly to talk about chapter 4.